The South African Patron for Global Alliance to End AIDS in 2030 has held a bilateral meeting with UNAIDS on the sidelines of the 25th International AIDS Conference, which is currently taking place in Munich, Germany. The bilateral meeting took place in the context of urgent action required to accelerate the Global Alliance country plan to ensure that South Africa meets the global target of ending AIDS in children by 2030. The global efforts to end AIDS as a public health threat by 2030 is led by UNAIDS as part of the Sustainable Development Goals. Deputy Minister for Health, Dr. Joe Phaahla, joins us now for more. Dr. Phaahla, very good evening to you. Thank you so much for your time. I mean, goals have been set to end AIDS by 2030. As we take a look at the pattern here in South Africa, what strides have been made and how far are we from that goal?
Well, thank you very much. Thanks for having us here at the International AIDS Conference in Munich, Germany. South Africa has made significant strides. Just this evening, the last session we had was a report in terms of surveillance which has been done by the South African Human Science Research Council, which tracks where we were almost 20 years ago when, as a country, we're not really geared towards, testing, counseling, testing, and treatment. And we have now made significant strides in the sense that over that period, the prevalence of HIV and AIDS have gone down since the massive rollout of counseling, testing, and treatment from around 2010. We scaled up in around 2014-15. Where we are now is that we have already, reached the 95% of people knowing their status, which is the target for 2025, 2026, where we are still having difficulty in terms of those targets is getting at the minimum of 90% of those who know their status to be on treatment. In that regard, we are still at 80%. But in terms of the last target, which is making sure that at least 95% of those who are on treatment are virally suppressed, we're not doing badly. We are at an area of 93%. But the key problem for us is still making sure that the estimated number of people who know their status, who are HIV positive, at least 95% are on treatment. But taking into consideration also in terms of the progress which has been made, as reported by the surveillance by Human Science Research Council, but which confirms also our own data. The difficulty, of course, the challenge for us is that as a country, we have the largest burden of HIV, even though we're saying we're at 80%. But that 80% speaks of just little shy of 6 million people, about 5.8 million people who are on treatment on a regular basis. But of course, as you introduced, the meeting between our patron, Mrs. Mashatile, with the executive director of UNAIDS, Winnie Byanyima, the focus there is on children.
Yeah.
When it comes to children, we're still just at around 65%, which is not good enough.
Deputy Minister, you speak about the Human Sciences Research Council survey. Having spoken to them this evening, what was found is that, it's all very well that there's a slight decrease in HIV prevalence for all ages, but there is an area of concern around new infection, more so as we look at the cohort of those 15 to 24 who are the least to be on treatment, only 63% on treatment compared to the higher age groups from the 40 and above cohort. What are some of the discussions around there? You speak about children, but a lot of those young people in that cohort are giving birth to children who are infected.
Well, that's an area of concern, and we have had a number of programs working with our partners, especially with PEPFAR. You might be aware that the number of programs over the last 10 years or so, some of which I still remember the program which our current president, when he was deputy president and chairperson of SANAC, launched in 2015 in terms of a program targeting adolescent girls and young women through what is called the DREAMS program, which is also still running. But we also last year, added some more impetus by also launching another sort of youth-focused program called Skala Ganjani. So we've got a number of entry areas where we mobilized young people basically to actually take the lead, have mentors of young people, including also the youth zones in our health facilities. Many of our health facilities now have what is called youth zones, where young people can come in and consult younger health workers at appropriate areas in the health facility away from the adult people. So this is happening in various primary health facilities after 4 o'clock, when the older people have already been attended. So there are a number of programs which we are rolling out. I also had a meeting earlier on with the global coordinator for PEPFAR, Ambassador John Kenkanso, having also launched a more global program in terms of focusing on young people, because we are not the only country which is still struggling. You would remember also that in terms of the young people, even during the COVID vaccination, where we didn't fare very well, is the same cohort of between 15 and 24. Yeah. So we also looking at messaging. What are the things which we need to do differently? That's why we are roping in young ambassadors to make sure that they actually take the front role in mobilizing young people to get tested and if they are positive, to be on treatment, but also for pre-exposure prophylaxis. These are the young people who at risk, who are encouraging also to enroll in the pre-exposure prophylaxis.
And that's one of the focal areas that organizations like the Treatment Action Campaign just this evening raising as a major concern, to say that as compared to previous years, that messaging and that sort of role from your department has dropped, because young people are no longer hearing it as clearly as those before them when it comes to knowing your status and ensuring that you do get tested. With that drive, what are you hoping to see as an indication that the messaging and those ambassadors are indeed working?
Well, indeed, we do acknowledge the fact that in terms of our government investment in the messaging, that has also dropped, but also we're getting expert advice in terms of, even as we want to ramp up again that the communication. These days you've got, unlike 10 years ago, we've got over and above billboards, pamphlets, radio messages. You also have social media. So that's why bringing in younger people to help us in terms of the kind of fashioning the right message. I mean, people have been saying you can't repeat the same message of 15 years ago. Times have changed.
Yes.
What appealed to young people at the time, we need to, so we're doing a lot of work in terms of just making sure that you're using the right platforms, but also the right content of message. And we hope that with the ramping up of that, I mean, it's encouraging that, notwithstanding the fact that we acknowledge sort of a drop in the kind of strong messages, but we see a decline in incidents of HIV, in other words, new infections. It's not significant. I mean, it's not up to the level of decline which we would want to see. So we're hoping that with that much focus, but hopefully also with new products which we're hoping can also become available in terms of prevention over and above, the behavior, enhancing behavior change, bringing in some more preventative tools, multiple tools, not just condoms, but various other tools, including oral pre-exposure prophylaxis, and hopefully very soon, significant access to also injectables or prophylaxis. All those we believe that could help us to really achieve our elimination of HIV as a public health threat by 2030.
Very well. Thank you so much for speaking to us this evening. Deputy Minister for Health, Dr. Joe Phaahla, joining us, of course, from Munich in Germany, where the 25th International AIDS Conference is currently taking place.